This segment is sponsored by VCU Health.
The doctor is in and you have questions. Do you have a sore throat, a runny nose, or muscle aches? It could be a cold, the flu, or COVID-19. The illnesses certainly share some similar symptoms, making it very hard to differentiate between them. Dr. Sangeeta Sastry, infectious disease expert with VCU Health, joins us to answer questions about the symptoms, incubation periods, and what we should do if we fall under the weather. It's great to see you, doctor.
Thank you, Jessica. It's good to be here.
Absolutely critically important conversation right now because these things are coming together in so many ways. What are some of the common symptoms that you're seeing in patients with COVID-19 that we would not see with flu or a cold?
First of all, I think it's important to recognize that patients infected with COVID-19, the flu, and the common cold have similar symptoms, and they often overlap. So the common cold tends to cause more milder symptoms, such as cough, congestion, runny nose. However, COVID-19 and the flu causes a wide spectrum of symptoms, ranging anywhere between being completely asymptomatic to more severe life-threatening illnesses. So some of the common symptoms that we have seen with flu as well as the COVID-19 infection has been fevers, chills, sore throat, cough, shortness of breath, muscle aches, fatigue, and sometimes the presence of non-respiratory symptoms like nausea, vomiting, diarrhea, neurological symptoms like confusion, loss of taste, loss of smell, even the presence of blood clots actually may clue you into the diagnosis of COVID-19 infection. So, however, for the most part, it is difficult to differentiate the clinical syndromes based on symptoms alone. And the best way to really do so is by testing.
Certainly by achieving that test, which can be very difficult to do. The incubation period is different between the flu and COVID-19?
Yes, it is. So what we define as incubation period is really the time interval between the first exposure to the pathogenic organism. Here it would be the virus and the development of symptoms. And COVID-19 and flu actually have different incubation periods. It is longer with COVID-19, ranging anywhere between 2 to 14 days. And then for the flu, actually, it's shorter, between 1 to 4 days. I might just add here that if you've had any close contact with someone who's tested positive for COVID-19 infection, please follow the CDC guidelines regarding quarantine and testing.
Absolutely, and it sounds like with all of them, if you're feeling the symptoms, it's time to pull back and wait and see, as you say, if you're experiencing those symptoms. The best steps that you advocate for prevention, certainly some of the protocols work well for all three, but what are your suggestions for prevention?
Yeah, regarding prevention, I believe the message has been loud and clear throughout this pandemic. Masking, especially when indoors, social distancing, avoiding crowded and poorly ventilated spaces, practicing regular hand hygiene, maintaining cough sneeze etiquette, and really the most important part is vaccination against COVID-19, along with booster shots and, of course, the yearly flu vaccine, all help to prevent the spread of the virus.
Doctor, we're just about out of time. We started talking about testing. Is there a particular test? Which COVID test should we be seeking out if we suspect that we've had an exposure or we may be experiencing symptoms?
Yeah, so PCR actually is the gold standard. It's a molecular test to detect active infection. But unfortunately, sometimes it takes a little bit longer. And so that's why we're using a lot of rapid antigen tests out there that have a faster turnaround time, but may not be as sensitive, especially if you test early on in your disease process. The other test that we have available is the antibody test. However, this provides information only on prior vaccination status and prior exposure to COVID-19, but doesn't really give you any information on active infection. So I would recommend using the Virginia Department of Health website for details on testing sites near you. And it's most important to remember that the local emergency department is really for emergency use only and should not be utilized as a public testing site.
Absolutely, a message that we all want to hear loud and clear. Dr. Sastry, thank you so much for talking with us.
Thank you.
For more information, you can visit vcuhealth.org. And please stay with us, Virginia This Morning. We'll be right back.